Procellera FlexEFit antibacterial wound dressings are powered by V.Dox technology. Employing a patented matrix of moisture-activated microcell batteries, they generate electricity designed to mimic the skin's internal electrical energy. V.Dox technology has been shown to kill a broad spectrum of bacteria while supporting the skin's natural healing process. Additionally, the unique FlexEFit design enables you to link and build the dressings, giving you the flexibility to fit virtually any length or curvature of incision with just one product size. This video will provide brief instructions on how to use Procellera FlexEFit antibacterial wound dressings. To apply, you will need the following sterile materials: 1 or more Procellera FlexEFit antibacterial wound dressings, Energel wound hydrogel, sterile saline or water, gloves, wound cleanser, skin prep. Cleanse the wound area with an appropriate wound cleanser. If desired, apply skin prep to the area surrounding the wound. To activate Procellera's FlexEFit microcell batteries, moisten the Procellera pad with sterile saline, water, or a thin, even layer of Energel wound hydrogel. Hydrogel will help maintain moisture and battery activation longer than saline or water. Following the instructions printed on the product liners, remove the number 1 liners and apply the dressing. Press gently to ensure direct contact of Procellera pad with the wound bed. Next, fold back the instruction liner. If you're only applying one dressing, remove the instruction liner and affix remaining dressing to the skin. Gently press and rub adhesive to firmly adhere. Pull either blue tab back at an angle to remove the backing. Gently press adhesive down. Remove the number 1 liners and apply the dressing. Press gently to ensure direct contact of Procellera pad with the wound bed. Next, fold back the instruction liner, but do not remove it. For the next dressing, repeat steps 1 and 2, adding 1 dressing at a time until the full wound or incision is covered. Take care to overlap additional dressings to ensure full seamless coverage. Starting with the last Procellera FlexEFit dressing applied first, remove the instruction liner and affix adhesive to the skin. Pull either blue tab back at an angle to remove the backing. Gently press adhesive down. Repeat steps 4 and 5 until all dressings are fully applied. With its patented link and build design, FlexEFit has the flexibility to fit virtually any length or curvature of incision with one product size. Remember that in order for Procellera's microcell batteries to remain activated, Procellera needs to remain slightly moist. Procellera FlexEFit may be left in place for up to 7 days unless otherwise prescribed. Earlier or more frequent changes may be required, depending on the amount of exudate present and the condition of the wound and surrounding skin. Consult a healthcare professional if any of the following occur. Signs of infection: increased pain, redness, or swelling, increased bleeding, maceration, hypergranulation, irritation at wound or surrounding skin. Wound increases in size after a few dressing changes. To remove Procellera FlexEFit, lift one corner of the adhesive layer and gently pull back, keeping the adhesive low and parallel to the skin surface. If the dressing adheres to the wound surface, moisten it with sterile saline or water until it can be removed without tissue disruption. Prior to use, please review the following indications, contraindications, and the instructions for use for a complete list of warnings and precautions.